We have many ways to manage pain after surgery. I think one of the big things is actually to recognize that some pain is going to be expected following the procedure. It is something that may be uncomfortable here and there, and that does not necessarily mean anything's wrong. However, pain that is not getting better or pain that really startles the patients, we do want them to reach out and let us know. For most patients, we will go ahead and do a nerve block at the time of surgery, trying to minimize the pain they have within the first about 12 hours following surgery. We'll often use a number of different oral medications to help with pain control, including at times a narcotic pain medication, although our goal right now is to minimize the narcotic use because we know that that will help patients' recovery, and we know that there are alternative options that can be just as good. Trying to minimize swelling is really important. In fact, this may be one of the things that actually improves patients' outcome as well as how quickly they recover the most. There generally will be a wrap on the penis that is meant to minimize swelling. If that wrap were to fall off, don't try to reapply it. It's purely, again, there to minimize swelling. For patients when they're up and active at all, the tighter the underwear, the better. The more support you can give yourself, the better it'll feel. As for kind of what position to sit in, what position to keep things in, the more you can aim the penis upright towards the belly button, the less swelling you'll have. Keep in mind, everything's going to drain downhill, so what we want to do is have that aimed upright. Additionally, if you can get a towel or an old t-shirt under the scrotum, between the legs, lifting the scrotum up, that's going to again help things to drain out and minimize the swelling that accumulates. It's really important to do this efficiently over the first 7 days or so. Ice can help, but when icing, be sure to use a small towel between the scrotum and the ice. We don't want frostburn. For most patients, there's not much they need to do with the incision. The incision is going to be closed with a absorbable suture right along the skin, as well as going to have some skin glue over top. That skin glue will naturally peel off over the first 7 to 10 days. In fact, can at times look even a little crusty as it does come off. The suture underneath will take quite a bit longer to reabsorb, so that area should not be opening up. In fact, the only things we really want patients to do for that incision would be to put some Neosporin on it if they like, and 2 to 3 weeks after surgery, if they're worried about how cosmetically it will look, to go ahead and use some vitamin E cream trying to soften that incision up. One thing I would say is we do not want patients putting hydrogen peroxide on the incisions. I know that that's been thought to decrease infections and utilized in the past in certain scenarios, but it also delays the healing and can actually slow the process. We like patients to start pulling down on the pump in the scrotum as soon as they're comfortable. That's generally not going to be in the first several days. However, by hopefully day 4, 5, 6, patients are able to gently grab that device, grab that pump, and slowly pull down. It is not something meant to cause significant pain, and is not something where patients are going to damage the device or the pump by pulling down on it as well. Further down the road, when we get patients back into a warm bath, which is generally going to be weeks 2 on, we will have patients additionally start pulling down then as well, and this will also give the opportunity to start to feel the different aspects of the pump, to feel the bulb as well as the deflate button, so that when patients are ready to get started by inflating and deflating, they have a better sense of what they're feeling down there. The simplest way to avoid constipation is to try to minimize the pain medications that's needed. Keep in mind, ibuprofen, anti-inflammatories are not going to cause constipation, whereas even the anesthetic from surgery can delay the bowels and lead to some constipation. As far as other ways to minimize constipation, using a medicine called Docusate or Miralax on a routine basis, once or twice a day, will not cause patients to have a watery bowel movement or things of that nature, but will help keep the stool softer so it does pass a little bit easier. I think the sooner we can get patients off of pain medications, the less constipation and discomfort they'll have. Following surgery, I do ask patients to minimize any heavy lifting, strenuous activity for about 3 weeks. That's going to allow particularly the reservoir to heal into place to where it's not going to move and get into a position that we don't want it to be in. While that's rare, it's still frustrating when it does happen. So we want patients to really minimize any real strenuous activity for the first 3 weeks. That should also help minimize recurrence of swelling or any excess bleeding. As for bathing, for most patients, we want just typically a shower starting about 2 days after surgery or when the dressing comes off. Go ahead and let the water just run right over the incisions. Try not to scrub that area. As far as bathing, for patients that prefer a bath, that's going to be okay starting about 2 weeks after surgery and ongoing. And in fact, for some patients, that'll actually help their discomfort heal up quite a bit quicker. Beyond that, I do not want patients to use hot tubs, swimming pools, or kind of swimming in a lake or ocean for approximately 4 to 6 weeks after surgery, where we can be sure that incision's well healed. As for other movements, a lot of it's going to be what's tolerated. For patients that like to get back to exercise, about 2-3 weeks in, we're going to have you start to slowly ramp up from there. As you can imagine, things like cycling are not going to be the easiest things to get back to. So most things are going to be pretty obvious for most patients as far as when can I get back to this? And if not, if there's any question or concern, again, please reach out to us. Patients should not drive for at least 24 hours after the end of their surgery to make sure all the anesthetic has gotten out. Additionally, we don't want patients driving when they're on narcotic pain medications or even the medication gabapentin, as this can slow reflexes and kind of increase risk. For most patients, they can get back to driving approximately 4 to 5 days after surgery when we've really kind of gotten more of the pain settled down and their reflexes are not inhibited by some of the medications. As far as work return, it's going to be very dependent on what patients do. For patients that are sitting at work or working from home, that's going to be an easier return because they're going to be able to even continue icing or at least provide some support throughout the day. For men that are doing heavy lifting, more up and down type movements, climbing, those are going to be a little bit longer process to recover. And in fact, for some of those men, we may even be about 3 weeks out after the procedure before we have them return to work. The typical recovery period following penile implant surgery is going to be between about 3 and 6 weeks. A lot of this is going to depend on swelling. Some of it may depend on pain tolerance, but most patients between that 3 and 6 week mark really start to feel quite a bit better and like things are returning to normal. Following surgery, we want patients to use their best judgment as to what may be concerning that they want to call about. In fact, we understand that we may go through this and talk to patients about the recovery quite frequently, but that for the patient, this is a new experience, and obviously we don't want you sitting at home concerned, worried, and anxious. That anxiety can actually make things a little bit worse, and therefore we don't want that. Give us a call. As for what we want patients to make sure they call about, we want to know about fevers, anything over 100.5 degrees Fahrenheit. We want to know if there's drainage coming out of the incision, particularly after the first day or two. I want to know if patients' swelling had initially improved and then all of a sudden started to get worse, or if patients are having fevers and chills, nausea and vomiting, things of that nature at home. Following surgery, our staff will generally reach out to patients, usually about 4 days after the procedure. One, to touch base and see how patients are doing, answer any questions that may come up, but also to set a follow-up appointment. That follow-up appointment is generally going to be somewhere around 3 to 4 weeks following surgery, at which time we will assess whether the patient is ready to start with the inflation and deflation process. Most patients are going to be ready to return to sexual activity approximately 4 to 6 weeks after the procedure. However, some patients with extra swelling, more discomfort that takes a little bit longer to recover from may actually find that it's closer to approximately 2 months following the procedure. During the recovery, if questions do come up, please reach out to our office staff, my nurses, or please shoot us a message through MyChart. Additionally, if it's a question or concern that you feel like needs to be addressed a little bit quicker, we always have someone from our group on call that should be available to answer questions even after hours.